All right. Before we start, I would like to introduce you to all the participants of our speaker. For the second speaker, all right. Right. So Dr. Abdul Hakim holds a PhD from University Science Malaysia. He's a lecturer one at Umaru Musa Yar'adua University, Katsina, Nigeria. His areas of research interest include multimodality and corpus linguistics. He's a member of Corpus Linguistic Association of Nigeria, Malaysian Corpus Research Network, International English Language Teacher Associations, English Scholars Association of Nigeria, Pragmatics Association of Nigeria, and among others. He authored books and published articles in national and international journals. So today he's going to present to us on the topic of social actors in public health, campaign posters from Nigeria Healthcare. Without further ado, I would like to invite Dr. Abdulhakim Saidu to present his topic. Dr. Abdulhakim, the floor is yours.
Okay, thank you. The title of my presentation today is Social Actors in Public Health Campaign Posters from Nigerian Health Care Facilities. I intend to present this article here just to hear from members of the group on how to proceed with a project I want to start next month, a project of building multimodal corpus. So the current research, I can say, is not corpus-based, but the intention is to hear from the audience how I can proceed with the creation or development of corpus data on this kind of data. So I proceed with corpus linguistic analysis of the social actors in public health campaign posters. Why public health posters? Maybe some of the audience might be thinking, why public health posters? Public health posters are all over in our hospitals. When I was in Malaysia, I can remember attending some health facilities. I saw different public health posters, but not many researchers took time to discuss or analyze public health posters with the intention of discovering how they make meaning or how the audience, the participants represented there, contribute or represent the meaning intended by the designers of the posters. So public health posters, as I said, maybe because they required less money for their production. So governments both at federal, state level, and local level in Nigeria produce these posters with the intention of communicating health issues to the members of society. The aim of this research is to examine how Nigerian public health posters use visual and textual strategies to prevent social actors and construct power, gender roles, and institutional responsibility, an area largely overlooked in existing health communication research. So this research is part of health communication discussed, but coming from the health posters point of view. The objectives of the study include, number one, to investigate how Nigerian public health posters visually and textually represent social actors, to analyze the inclusion, exclusion, and role allocation of social actors, and lastly, to uncover the ideological functions of public health posters. The literature review revealed some outcomes. For example, it highlights that public health posters serve not only as informational tools, but also as ideological instruments that shape social norms, particularly around gender roles and healthcare responsibility. Uh, it, it emphasizes that design choices such as imagery, actor, positioning, and language play a crucial role in constructing meaning and influencing public perception. The literature review highlights that public health posters in Nigeria serve not only as informational tools, but also as ideological instruments that shape social norms, particularly around gender roles and healthcare responsibility. Lastly, it emphasizes that design choices such as imagery, actor positioning, and language play a crucial role in constructing meaning and influencing public perception. Methodology. 100 posters were purposefully sampled and subjected to analysis based on Lewin's, Van Lewin's social actor network. The analysis was done based on three factors. Number one, the inclusion and exclusion of social actors in visual representation. The overall analysis here indicate that posters construct a narrative where health responsibility is individualized, feminized, and disconnected from governmental support. Like when we look at this poster, we can see we have different, like 6 or 7 kids, all of them affected with different elements. Like the first one, handled by this first woman, is refusing to feed. The second one, this one is vomiting. This one has diarrhea. This one convulsions. This one fast breathing. This one fever. And the last one malnutrition. But in the whole foster, we only have female actors. The woman, which is acting as the mother here, and another woman acting as the house provider. So looking at this and many other posters depicted in such design, it shows that mothers are consistently included in health posters in Nigeria and depicted as primary gendered expectation around children and healthcare responsibility. There is a kind of belief in Nigeria, especially in the northern part of Nigeria, that healthcare, especially in relation to children, is women affair. It's mother that will take such kids to hospital, and nurses are mostly women, and even the doctors, mostly pediatric, are also women. So this is a gendered inclusion. Number two, fathers are often suppressed, completely absent from visual and textual narrative, suggesting that male involvement in children's healthcare is culturally insignificant or discouraged. Number three, healthcare professionals like doctors and policymakers are either excluded or backgrounded. This is minimizing the visibility of institutional support and shifting responsibility to individuals. Next, rural and economically disadvantaged individuals are frequently depicted. So in the posters, mostly the social actors are villagers. Rarely people of high socioeconomic background are represented or depicted in the public health posters. Likewise, children are shown in passive, vulnerable states, and also health facilities are presented in the background, implying institutional presence and but downplaying active engagement by medical staff. So as you can see here, as explained in the previous slides, mothers are included. And by including them, it reinforces gendered caregiving roles, positions women as solely responsible for child health and the rest. The next is role allocation and power relations in the corpus. Looking at the posters like these two inserted here, health professionals such as doctors like this one, nurse like this one are typically activated. So almost in all the posters, wherever health providers are depicted, they are shown to be given, they are activated, they lead. Sometimes they are depicted holding tools like this one, which signifies authority and institutional control. On the other hand, patients who are mostly women and children are mostly passivated, receiving the actions of the health givers, like the doctors and the nurses. So they are often depicted receiving care or listening for advices from the health providers, which portrays them as dependent and less empowered. The government and NGO institutions are symbolically activated also through logos, directives, and authoritative language, reinforcing legitimacy and policy power. Community members have mixed representation, sometimes activated in participatory roles, but more often participated as recipients of information. Diseases like TB and COVID-19 are occasionally activated through visual metaphors portrayed as active threats that must be contained. Posters are visually, posters use visual composition, such as body posture, gaze, partial placement, and linguistic choices, such as imperative, formal tone, to maintain top-down power dynamics. So the healthcare providers like doctors and nurses are always at the top, while the patients who are mostly women and children are always below them. So the ranking is always doctors or healthcare providers providing directives, authoritative directives, while the patients await directives and act based on the directives of the doctors and the nurses. So this is summarized in this table, the role allocation and power relations in the 100 posters sampled for analysis. The next is spatial composition and body positioning in hierarchy construction. Health professionals are often depicted standing, while patients are seated or kneeling. This visually reinforces authority and subordination, just like what we saw in the and emphasizing their role as primary source of knowledge. Doctors are made to act as either healthcare providers or knowledge providers. So they either cure or they educate the patients. Patients and symptoms are placed in the background or lower frame areas, minimizing their visual prominence and agency. Foregrounding of health workers signifies institutional importance, while backgrounding of patients and facilities suggests passive and secondary roles. Body posture conveys hierarchy, upright, gesturing professionals versus leaning or still patients, highlighting a one-way flow of information, always from top to bottom. So the patterns in spatial arrangements across posters is represented in the table. As the next is facial expressions and gaze, emphasizing authority and vulnerability. Doctors and health professionals are often shown with neutral or confident facial expressions, conveying calmness. So they are mostly depicted calm, with expertise, professional, and having control over the situation they are depicted in. While patients, especially women and children, are depicted with distress or downcast expressions, highlighting vulnerability, suffering, and dependence. Direct gaze by professionals looking at the viewer or interacting with others. This creates a sense of leadership, trust, and engagement. Averted gaze or covered faces in patients, especially in HIV or TB posters, signify shame, fear, or loss of agency, reinforcing stigma and helplessness. So the pattern across the 100 posters is also represented in this table. Lastly, the textual and linguistic strategies, agency and audience engagement. Some number one, imperative expressions are used in the posters, such as go for checkup, report symptoms. These are authoritative and common directives instructing the public to act or perform certain action. This is actually offering limited agency to the audience. Yeah, instead of engaging the audience critically, this kind of representations expect the audience to comply. The third-person constructions are references, such as people with TV shows. Yeah, this depersonalize the subject, treating affected individuals as generalized or symbolic, which reduces their active presence in the message. First-person appeals, like I took the vaccine, so should you, are rare but create a more personal and relatable tone, promoting behavioral modeling while still aligning with institutional messaging. There is also the use of medical jargon, medical terminologies, such as antiretroviral therapy adherence. This is frequently used in posters dealing with complex conditions, which may reinforce the authority of health professionals, but alienate lay audiences, especially those with low literacy, those coming from the remote areas. So these linguistic strategies collectively reinforce a top-down communication model where health workers speak and the public is expected to listen and obey rather than participate or custom. Major findings. Number one, health responsibility is feminized, as we saw in some posters. Mothers are consistently depicted as the primary caregivers, while fathers are excluded, reinforcing traditional gender roles in healthcare. Institutional and policy actors are visually and textually separate, shifting the burden of health from systematic structures to individual action, especially women's action. Power dynamics are visually encoded through spatial composition, and poster health professionals can and instruct while patients sit and receive, reinforcing hierarchical communication. Lastly, patients and vulnerable groups are participating in both visual and text, shown as recipients rather than participants in healthcare decision making. Findings: public health messaging promotes top-down model with expert voices dominating while community members are portrayed as dependent and uninformed. Semiotic resources like color, facial expression, and gaze are used strategically to convey authority, like doctors in white coats, while confident, with confident expression and vulnerability to stress patients in dull settings. Language choices like the use of imperatives, third-person references, and medical jargon further limit audience agency, emphasizing compliance over engagement or dialogue. Conclusion. It has been concluded that Nigerian public health posters function as ideological tools, not just informational material. They reinforce traditional gender roles, especially by portraying women as sole caregivers and excluding male figures. Institutional and systematic actors are suppressed, placing the burden of health solely on individuals, particularly women. Hostels adopt a top-down communication model where health professionals are authoritative and the public is passive. Visual and textual strategies like posture, color, gaze, and imperatives create and maintain power hierarchies in health messaging. Lastly, these communicative choices risk alienating audiences and reducing the effectiveness of public health campaigns. Based on this, some recommendations have been provided. Number one, diversity representation. It is recommended that henceforth the posters should include fathers, youth, and community leaders to reflect shared responsibility in healthcare. Number two, there should be the use of imagery that portrays patients and communities as active participants, not just passive recipients. Simplify language, avoid medical jargons, and use clear, accessible language to enhance comprehension and engagement. There is need for shifts from fear-based messaging to collaborative visuals and inclusive narratives that build trust. And lastly, there is need for the designers to be trained in multimodal discourse awareness to equip them with tools to critically assess and improve visual messaging, ensuring it is socially inclusive and context sensitive. So here comes the end of my presentations. I await your questions, contributions, and comments. Thank you all.
All right, thank you, Dr. Abdulhakim. Is there any questions from the participants before I proceed with my questions to Dr. Abdulhakim? Any questions from the participants? I think this is focusing on more on the multimodality studies, and also can be related to discourse analysis. Anyone? All right. I think I have one questions for Dr. Abdulhakim. Is this is your studies or your project is the first one who's going to like look into the multimodality aspect of the healthcare campaigns in Nigeria, Dr. Abdulhakim?
Actually, no. There
No.
are some few researches based on my literature site. I discovered like three articles published, but all
right.
of them collect data from the southern part of the country, while my research focuses on health posters from the northern part of Nigeria.
All right. Okay. I have another question. Is it because of the social problems like pandemic, or like for example, like your slide just now mentioned tuberculosis, TB? Is it because of that pandemic that the Nigeria healthcare system does not provide very effective advertisement for the Nigerian people?
Sorry, can you take the question? There is
Is it
a
because of the
network.
social problems that you are having in Nigeria that they don't get the response from the people that you are that I think because you want to start the project here. Is it because of the social problems in the country?
Yeah, I guess. Yes, I guess so.
Okay. All right. Any questions from the floor?
Maybe I do have one.
Okay. Thank you, Raina.
Okay. So, Dr. Abdul Hakim, I liked, when you showed, what certain gestures mean and
Yes.
so on. And I think you will choose 100 posters, was it?
Yes.
Okay, all right. So I mean, how will you analyze the data? Is it about counting, whether this poster shows this kind of gestures and so on, or I mean, how will you
Analyze.
present your data after the analysis? Is it about numbers,
Yes.
or is it just about how it is done and so on?
No, the analysis is purely qualitative. I pay attention to the social actors, like the women portrayed, children, doctors, and then I analyze them based on the multimodal resources deployed in the creation of the poster. So at
Mm,
long run, the findings will be uh, the kind of gesture displayed by the represented actors, the kind of interaction between the represented actors and the general public who are the consumers or the targeted audience of the posters.
mm, I
Yeah.
see. Okay, all right. So, how this study is corpus is based on the collection of posters that you would have, to be analyzed.
Yes, as I said, this is just the beginning of the
Mm,
project.
yep.
Now, what I want to do is develop a multimodal corpus. So
Mm,
when I develop the corpus, then the analysis might to be both qualitative and quantitative, depending on the materials available for the corpus building.
mm. Okay. There's a lot of potential in this project. I can see, based
Yes,
So,
yes.
on, right? There's a lot that you can
yeah,
do.
And there's
Looking.
yeah,
a
Mm,
lot of
yeah, and of course,
a lot of a lot of perspective that you can have a little,
mm,
using the
yeah.
social factors itself. You can cover like vast amount of
Yes.
data.
Mm.
yeah,
And
yeah.
And in fact, maybe this is just a sneak peek. In our next webinar, we are inviting a team of researchers, and they will be doing a workshop on multimodality and corpus. So hopefully, all of you can come and see
Okay.
how exactly they will do it. I've always been, interested to know how exactly people connect language with images, because when we are linguists, our focus is usually language, and when we look at image, that one is like we are going outside our comfort zone. So
Right.
I'm always interested in seeing how people actually do it. So yeah, this is, your study shows that you are trying to you know, jump into this kind of thing that not many people, have
Yeah,
the courage to do. Okay, all right. So
yeah,
yeah,
sure, sure.
uh, that is my comment and questions.
Okay, thank you. Thank
I
you.
just have like one question to ask. Are you going to analyze the colors of the posters as well, Dr. Abdul Hakim?
Sure. Yes, sure.
Yes. All right, so
Yeah.
probably the symbolize something where you get the data later on. All right, I wish you all the best, Dr. Abdulhakim, with your project. I think
Yep.
a lot of things need to be covered
Thank you,
using
Vidya.
your methods of multimodality, and hopefully we can see you in the next webinar whereby we're going to invite one of the expertise in multimodality
True. Yep.
approach.
Mm.
All right, so thank you, Dr. Abdulhakim.
Welcome.
All right,
Thank you.
so
Welcome.
thank
Thank
you.
Okay,
Before we
bye.
end our, all right, thank you, Dr. Okay. Okay, so before we end our session, I would like to remind to all the participants to fill in the certificate of attendance form for the MCRN webinar on April 2025. The link is provided in the chat box. So thank you so much for coming to our and joining us in our webinar. Hopefully we can see you again in our next month webinar 2025, whereby just now Rahana just mentioned that we are going to invite a multimodality expert in how they're analyzing the data.